Okay, so errors in panoramic radiographs. All right. So I think, again, just because I didn't say this in the recording, the first bit is you guys kind of understood the panoramic physics. And then we sort of looked at how we take panoramic radiographs from the moment the patient walks in until they're done, and then where errors can happen anytime within that process, from the beginning of telling patients to take off their earrings and metal, all the way to the very end when it's going around the patient's mouth, when it's going around the patient's head and the patient swallows or anything like that. So now we're just going to take it chunk by chunk, and then we're going to do something a little bit more interactive. Okay. All right. So as we saw before, panoramic errors can happen, and the same thing we did in intraoral radiographs. Panoramic errors can happen anytime during image acquisition, preparation of the film or sensor, preparation of your machine, preparation and positioning of the patient, or during the exposure. So we talked about sensor preparation. So this one is something that I think I already taught. I'm not going to show the video on this one because we just saw it. So basically what we're doing with the sensor preparation is we're going to make sure that the sensor is in its position. And when the patient comes in, I'm going to set the machine to how tall the patient is. So if I'm going to go walk in, it's going to be very different than another patient that walks in. We're going to set the machine to my height before I even get into the machine and start positioning. If I have a little kid, if I have a little child, then I'm going to bring down the machine all the way to the little child. If I have a patient on a wheelchair, we're going to bring it down to that patient, depending on how they are before we even start. So we're going to kind of eyeball the patient's height and bring it to their height. The other thing we're going to do during this time is we're going to put in the bite stick. If the patient is able to bite on their front teeth, we're going to use a bite stick for them to bite down on the bite stick. If the patient doesn't have any teeth or is edentulous or anything, we're going to use something called a nose rest instead. So those are the things that we're going to prepare before the patient even stands in our machine. And I'm not going to do this because you guys already saw this part. Okay. So that's what we did with we're side of preparing the machine. 1 second, let me see.
The next step.
Yeah, we already did this. Okay, so patient preparation is going to be important. So remember what we said before. The first thing we're going to do is we're going to explain the procedure to the patient. We're going to tell them what's going to happen, give them a brief overview that this is going to go around your head. You're going to have to be still for the entire time. You know, somebody needs to take a sip of water or whatever. Just tell them all of these things before you start preparing the patient to get in the machine. Most importantly, patient has to take all removable metal off of the head and neck. Why the neck? Upward positioning of the beam. So anything that is on the neck will be projected onto the panoramic radiograph. Now, necklaces, any ear piercings need to be removed. Any facial piercings need to be removed. Any glasses need to be removed. You will find and we see this a lot in our patients, especially in our pediatric patients, and specifically with it's interesting, with some nationalities, they actually put in earrings into the kids' ears and they weld it in it so that they don't come off, so they don't lose their earrings. When you start pediatrics, inshallah, next semester, my advice to you guys is to tell your patients before they come in that they're going to need to take off all their earrings before they come in, because you are going to be taking radiographic images. So that way the mother knows that if they need to be removed professionally, that they can be removed professionally before they come to their appointment, and let the mom know that they need to be taking their earrings off. Also with your adult patients. With your adult patients, now with the increase, we're seeing more and more people with facial piercings. If you think you're going to be taking a panoramic radiograph, you need to be telling your patients that you will be asked to take out facial piercing, nose rings, tongue rings, earrings, so that they know that they have to remove them. Again, patients will come in and say, "Oh, I have an earring. in my ear. I've never taken it off before. It'll be something in the, I don't know, a tragus thing or whatever. You let them know before if they need to remove it professionally. And the other thing that they're going to tell you is they're going to say, oh, I've done plenty of x-rays before. No one has ever asked me to do it. We'll talk about why it's important to do this a little bit later, but keep your quality assurance, keep your quality high. Always remove facial piercings regardless. Okay. If somebody can't remove them, then we might have to change the technique or change to another technique. But let your patients know beforehand so that they can come ready to their appointment. Okay. All right. So patient preparation, that's the first thing. And then we're going to start preparing the patient. So I'm just going to quickly remind you with this.
Ensure that the patient removes all metal from the neck up.
Okay, we already talked about this. We talked about earrings and their ghost images, removable dentures. I see this so much. People will forget to ask the patients to remove their removable dentures. So dentures need to be removed. Never use the thyroid collar. Never use the thyroid collar. We can still be using the shield again in Kuwait. And again, what we're going to be doing here is going to be positioning the patient properly with mid-sagittal plane in the right area so they're not too close or rotated to one side of the other. And we're going to have them stand as straight as possible so we can get rid of slumping. And then what we're going to do is we're going to make sure that the patient's chin is not too far downwards and not too far upwards. And we're going to make sure that the anterior and posterior positioning of the patient is correct. And we're going to do this interactively in a second. And then what we're going to do is we're going to give the patients the proper instructions to keep their tongue flat on the roof of their mouth so that we don't get any air in the oral cavity or in the oral orifice. Okay? So let's take a look at some examples here. This is somebody that decided that they were going to take a radiographic images with everything on. They have their glasses on, they have their earrings on. If you look at the right side, you can see the earrings on this side. Over here, this is the ghost image of the right earring. Here you have the true image of the left earring, and over here you have the ghost image of the earring. Over here, can anybody tell me what this, you can open your mic if you want, what this error is here?
Thyroid collar.
Yes, thyroid collar, excellent. And over here, this black burnout area, does anybody know what that is? We talked about it a second ago. When we asked when the
Our
patient—
tongue is not on the palate.
Very good. The tongue is not flat on the roof of the mouth, which means we have an airspace between the palate and the tongue. Excellent. Okay, this is a fun one. This is a fun error. And I think it's only here. أظن بس في الكويت. والله ما أدري. But can anybody think about what this error is? This is a fun little one. Can anyone imagine what this one is? So this is metal, metalish. So this is actually what do you guys call it بالكويت لفة طرحة طيب عليها استراسات. So this is a hijab with crystals on them. So what we tell our patients is when they do have a hijab that has crystals or anything like that, we usually give them a shield where we close the room for them, ask them to remove their hijab in the privacy of the room, and then we take the radiograph. But make sure when you're looking at your patients to make sure they don't have anything like that. Now, recently, we've been asking all of our patients with hijab to take off their hijab to make sure that they don't have any pins or anything in their hair, and at the same time to make sure that their hijab doesn't have anything on it that will cause artifact. Okay. Exposure, طبعا, as we said before, exposure we can make errors in exposure time, either not clicking all the way to the end, or if the patient is too hunched forward. So during the exposure, it hits the patient's side. So we get one side only because the machine will stop automatically for safety reasons if it hits the patient's body, and you'll get half a panoramic radiograph only. And of course, you can get something that's too dark or too light if you don't put in the proper set.
Is now prepared to.
Okay, so before we get into the interactive part where we're really going to understand things, inshallah, what happens when we ignore errors? And I know that a lot of people think that I'm very, very strict when it comes to avoiding errors. People think I'm a little bit too strict when it comes to metal artifact and earrings, and I've had complaints from doctors, I've had complaints from patients, and everyone says, "Oh, I've done this 100 times and no one asked me to take off my earrings. Why are you asking?" It's because of what I've seen. And I'm going to show you this particular case. That was actually a court case. I took permission, by the way, to use this for teaching purposes. So this is a patient that was going to her orthodontist, and this isn't a time. This is a little further back, but I can imagine it happening also with earrings. It can have the same effect. So as you can see here, this is a panoramic radiograph that the orthodontist took at the end of treatment for this patient, and they were just basically looking at the parallelity, let's say, of the roots of the teeth after treatment. And they had this big fat artifact on the maxilla here. And they decided that, you know what, whatever, it's an artifact, it's not in the area of interest. I'm just gonna look over here and everything looks fine. Beautiful teeth, take a picture, go home, goodbye, right? Patient 6 months later ended up in the emergency room because of severe, severe sinus pain. This is a young child, obviously, not child, but this is, younger than 17 because the third molars are not there. But anyway, ended up in the emergency room, major sinus problem. And they took a panoramic radiograph in the emergency room because they wanted to see if it was odontogenic. And basically what they saw is this tooth over here that had been pushed upwards. There's loss of the floor of the maxillary sinus, loss of the lateral wall of the maxillary sinus, the posterolateral wall of the maxillary sinus. Now, the patient had come in with retainers, so they knew that the patient had just finished orthodontic treatment, and they asked the patient, "Did your orthodontist not see this?" And she said, "No, my orthodontist didn't see it, and they didn't say anything about it." So if we go back here, if you look really closely, you can see that something was going on here, but it was completely obstructed by artifact. So when they did a CT, this patient has a huge cyst that completely obstructed the osteomeatal complex. And basically what happens is you get what looks like a cyst and a mucocele, and it causes, and this actually went all the way up to the floor of the orbit, and the patient had a lot of problems, but the patient basically sued the orthodontist for not seeing it. So when I say make sure you don't have any errors on your panoramic radiographs, when I say please don't have earrings on, because this could have been a ghost shadow of an earring. If the patient was wearing earrings, they could get a ghost shadow right over here that can obscure something in the maxillary sinus. And you can get into a lot of trouble if you don't see it. So the issue isn't getting in trouble. The issue is about making sure that whenever we're ordering our radiographs, you have to remember that as the referring doctor, as the one reading these images, you are responsible for the entirety of the field of view. And if there's anything wrong, and if it's obstructed with something else, it's still your fault. It is still your issue. Let's not say your fault. It is still your issue. So make sure that you can visualize everything. And the only time something can be obstructed is if it's something that can't be removed for any reason. A hearing aid, an implant, something, a non-removable hearing aid, of course, then that is something you can't do anything about. But if something removable, always remove it. So I hope that nobody gets into that scenario, or nobody gets into that situation ever. So now I'm going to stop sharing this particular screen, and we're going to go into our other screen over here, and we're going to have some fun here with this screen. Okay, so can everybody see my screen?
Yes.
Perfect. Okay. All right, so I want you to say hi to our little to our simulator here. So this is our simulator. And what I want you to see over here, what we're going to be doing is we're going to be creating our own errors. Okay. It's the same way you guys do it in clinic. So if we look at our simulator over here, you can see her from every which way. So this is the central line. You can see the line right here that goes right through the nose into the this is your mid-sagittal plane. And then what we see over here is your allotragus line, which is the line that should be parallel to the floor. And then when we look over here at the patient's side, you can see the canine line, or the lines that go between the canines. So what are these indicators? The one in the center is going to make sure that the patient's mid-sagittal, they aren't rotated to one side or the other, or tilted to one side or the other, right? Your allotragus line is going to help you know if the patient is tilted upwards or is tilted downwards, right? So chin up and chin down. Now, the canine line is the two lines that are going to be over here. They're going to make sure that you're not too far forward and you're not too far backwards, okay? So let's see what happens when we take this beautiful image where the canine lines are on the canine, mid-sagittal plane is on the mid-sagittal plane, allotragus line is perfect. Let's take a radiographic image. It goes around the patient's head. Boom, it looks great, right? So all the structures appear clear, without distortion. The occlusal plane bends gently upwards in a slight smile, right? And we can see all of our structures. Now let's try some different positions. So the first one we're going to try is we're going to look and see if we put the patient's head, okay, let's do this based on how we get this right with the patient, okay? So the first thing we're going to do, we're going to have them sit in the machine, and we want to make the mid-sagittal plane is right in the center, right? That's the easiest thing. What happens if we get that wrong? Meaning the patient is turned to the left or the person is turned to the left, to the right. So what we're going to do, let's turn the patient ever so slightly to the left. If we look what happens to the focal trough, one side is going to be very close outside of the focal trough and close to the film, and the other side is going to be further away, and it's going to be, some areas are going to be outside of the focal trough and the other side. So this is what it's going to look like in 3D inside the patient's mouth. So you can see that the mid-sagittal plane is off here. Let's take a radiograph and see what happens. Boom. Basically, what you have is one side is magnified on one side because they are rotated in that direction, and the other side is one side is going to be magnified because it's further away from the film, and the other side is going to be minified because it's closer to the film. And what we get is asymmetry between both sides, right? And the same thing's going to happen if you rotate on the other side. So if you rotate on the other side, the exact same thing is going to happen, but you're going to get magnification and minification of another side, right? So again, if we look at this here, one side is going to be way too close to the film. The other side is going to be further away from the film, causing magnification on one side, minification on the other. Let's take a radiograph. And again, magnification on one side, minification on the other. So back again, mid-sagittal plane, you turn one side or the other, you get asymmetry with magnification on one side, minification on the other. Now let's say our mid-sagittal plane is fine, but now what we're trying to do is we're trying to make sure that the height of the patient is correct. So we want to bring his patient's chin in the right position, or we're going to bring the patient's chin in the incorrect position. So what I'm going to try to do here is we're going to have the patient, by mistake, have their chin tilted too high because the chin rest is too high, or we put the chin too high for the patient. So let's put the patient upwards and let's see what happens to the focal trough. So everybody look at the focal trough. Up. So what happened? The focal trough, what you have here is the chin is upwards. The palate has now gone down. The palate has gone down. You have a reverse smile line. So instead of it being a nice, gentle smile, it's going to look more like a frown. And the palate is now superimposed on the teeth themselves. So let's take a look at the radiograph that's going to result from this. A reverse smile line. The palate is superimposed over the teeth, and you can see the condyles are downwards, so they're projected downwards. Why? Because I brought my condyles downwards here, so they're down here, and the palate is now superimposed, which we don't want. So what happens if we do the opposite position? So eyes over here, over the three-dimensional image. Let's put our head down. So the head is downwards, right? And the condyles now are outside of the focal trough. And what we have is a reverse smile line, not an exaggerated smile line. So instead of it just being a regular smile line, it's going to be exaggerated with a very steep angle. And what is it going to look like? It's going to be an exaggerated smile line, and the condyles are going to be kind of kicked out of the field of view. And of course, the mental area will be kicked out as well. Okay. All right. Let's try another position. So now we have the patient straight in the machine, mid-sagittal plane. We also have the perfect position of the chin right in the right position. And now what we want to make sure, if the patient's too far forward or too far backward, we want it perfect. The perfect position is if you ask the patient to smile. The lines that we have here, we call the canine lines. Remember, the patient's edge to edge. So the canines are coming right on top of each other. So you want that line to go right through the canines. If they're going right through the canines, you're on point. What happens if I take the patient too far backwards? Look at where the canine line is. It is at the lateral incisors. And what have I done? I have taken back the whole mandible and maxilla backwards because they've gone all the way back. And condyles are cut out. This area right here is too far. This is way too far back. And what's going to happen? Remember, when we go further away, we're going to cause magnification, exactly like a shadow. So we get magnification of everything, and your condyles are going to be sort of kicked out of the of view. Now, and by the way, you can read down here later on if you want to take, because there's another part that I want you to look at. So the structures in the anterior region appear much larger, distorted. This is because they're positioned further from the image receptor. The posterior region of the mandible is not imaged. So let's go, what happens if I go too far forward? What's going to happen to my canine line is going to go all the way back here. And now what I've done is I brought everything forward, right? And what do we see here? It's outside of the focal trough, so it's going to be blurred, and it's going to be minified, the opposite, right? It's going to be minified. So let's take a radiographic image of this. See how everything became smaller? The whole jaw. It should fill your film, but instead of that, because you're too far forward, it all minified and became an itsy bitsy bitsy little mandible and maxilla, especially in the anterior region. So all the structures of the jaw appear smaller, especially the anterior teeth. This is because they are positioned closer to the image receptor, resulting in minification. And the problem with minification, when everything is so small, you get a lot of overlap and you really can't see anything. Everything is overlapped because everything is just squished into a smaller region. Okay, does everybody understand that part? Yeah, we're good? Excellent. So what we're going to do now is the next part is we want to explore our understanding a little bit. So I want this to be a bit interactive. So what do you think is responsible for the abnormal appearance of the left mandible? You can unmute yourself, or if you want to write it in the chat, you are also welcome to do that.
Patient was not in the center.
Any other opinions? I don't know where the chat went, actually, to be honest. Where'd my chat go? You guys actually don't put the chat because I can't see the chat box. Okay. Any other opinions? Oh, I have a chat here. Okay. Okay. Any other opinions? Patient moved. Yes. Very good. The patient moved. You're absolutely right. Fatima, can you tell me when the patient moved, when the panoramic was going at what part?
When the pano was moving to the left,
Yes, exactly.
patient moved to the right.
When it was moving from the left to the right. So the patient there, it could be a swallow, it could be a cough, it could be something that happened, but they moved during that time. So let's see the answer here. You are correct. The patient moved his head during the exposure of the left side, resulting in distortion and blurring of the structures in that region. All right, next. What is the error?
Dentures.
Yep. Dentures. So you have to ask your patients about this particularly and specifically because sometimes people have really good dentures and it looks like they don't have dentures. So you have to ask them beforehand, do you have any removable devices inside of your mouth? Whether that is ortho, retainers, or if that is dentures. Because as you can see here, we can't see anything at all. So what is the answer? Maxillary and mandibular removable partial dentures have been used during the imaging, obscuring all the information about the teeth. Okay, all right. It's gonna be a little bit more difficult now. Okay, what do you think is the mistake here?
Patient is too forward
Okay, why do you think so?
because the image looks smaller.
Right, and what about the anterior teeth? Yes,
They're not clear
and there's
and there's a lot of overlap.
صح. Very good. Overlap and the teeth look really small, correct? And you are absolutely right. The position was patient too far forward. صح. They were too far forward relative to the focal trough. This has brought the anterior teeth closer to the film, resulting in minimizing this appearance. The other thing that we see with this minification in the simulated patient, the simulated patient didn't have a neck. But what do you see in the anterior parts now? What is that white part? Right here, a little white. Can anybody guess what that is? So that's the spine. Again, yes, somebody said it here. Cervical spine, yes. So what happens when the patient moves forward? What is moving forward also? The cervical spine. So when we're bringing the cervical spine closer to the focal trough, we are now bringing it into the image, correct? So what happens is you get minification and you can also get a lot of spine because the spine now is not, instead of being outside of the focal trough, is now moving inwards closer to the focal spot so you can see it more, okay? Ooh, this is my favorite one. You guys, this is literally my favorite one. What is responsible for the abnormal appearance of teeth number 47 and 34? So let's do a little bit of, let's try to remember when we did the caries, when we did caries before. So this is quadrant 1, quadrant 2, quadrant 3, quadrant 4, correct? But this is patient obviously is in the mixed dentition, correct? So they also have quadrant 5, 6. Actually, let me do that for you guys. I'm finally going to use the annotation. Woo. Okay, so here is quadrant 5, right? Allah al-khat. 6, 7, and Allah, look at my 8, you guys. Wow, I don't even know what that is. Okay, that's my mouse. All right, so the question is 7, 4. So this quadrant right here, and of course, let's put in our other one because I know some of you guys are like me, and we are a little bit, we get confused with these things. So for the adult, this is 1, 2. Oh, Why did I do that? 2, 3, quadrant 3, Allah, and 4. I never knew I was this useless with drawing with a mouse. All right, 4. Okay, so 1, 2, 3, 4. So the question is 7, 4, and 3, 4. So let's look at our quadrants here. So 7, 4 is this over here. So we're looking at this one and this. So when you look at this image, what do you think?
Did the patient move the tooth with their tongue? Because their tongue is not in place.
Okay, all right. So you are correct. Movement. All right. Now I'm just going to put the tip here. This is the retake of the image. Okay. This is the retake. Whoops. Whoops. Look at the image after I retook it. What do you think happened? This is moments later. Whoops.
Now it's clear that they are two teeth. Before it was like wider.
Yes, it looked wider, right? So if we were to go back and just look at this one more time, ooh, it won't, I have to answer the question. So if we look at it before, it almost looked like a dental anomaly. It almost looked like somebody had a gemination or fusion or something going on there. But this kid actually moved during that time. So let's put the answer, and you are correct. Ooh. Let me put this back. Oop, there we are. Answer. So yes, the patient moved his mandible at the same time that the X-ray beam was passing right through 7-4 and 3-4, resulting in the enlargement and blurring of the teeth. Note how this subtle presentation could be mistaken for a developmental anomaly. So movement can sometimes be so subtle. And this is, by the way, this is not something, a strange, weird anomaly. I see it a lot, especially with kids, because they do move a lot and they do small movements. So we will see things like this and they will be movements. It's not a rare thing. So whenever you're looking at cases like this, you want to make sure that there's no, and if this is the situation here, I know they retook a pan, but the easiest thing to do here is to do a periapical here and make sure. And if everything goes back to normal, you know that it's movement. Okay. All right. Ooh, this is a nice one. Next. All right. Say it out loud or pop it in the chat.
Patient is not in the center.
So what happened here?
Patient's face was facing right a little bit.
Okay, so the patient's rotated, right? Is that what you mean? Yes. So this is a rotational error, one side or the other. Fatma, can you tell me, what do you see here? What is the visual thing that you can see here?
Okay, the teeth on the right look smaller than the teeth on the left.
صح. والماندبل?
The ramus on the left is huge. The ramus on the right is smaller.
Right. Beautiful. Thank you very much, Fatma. That's exactly it. So in these situations, we always have a problem because we want to make sure, is this a true asymmetry or is this an asymmetry due to rotation? So how do you guys think we can differentiate between true asymmetry, skeletal asymmetry, and rotational asymmetry? There's a trick.
Compare the mandible on both sides.
Compare what?
The mandible on both sides.
So let's say the mandible is asymmetrical, okay? كيف أعرف إنه الasymmetry is not due to a rotational error and it's true asymmetry? شلون أعرف الفرق؟
Compare the picture to the patient.
That's a very good thing. But it could be subtle. It could be subtle. Let me ask you this. In a patient with skeletal asymmetry, true skeletal asymmetry, do you think the teeth will be affected? Yes, who said that? Teeth, if the teeth look distorted. Yes, look at your teeth. Exactly. So if we are looking at a rotational error, both the teeth and the mandible will look asymmetrical. Both of them will look asymmetrical. So they'll look distorted and they'll look enlarged. However, in a case that has true asymmetry, a patient has true asymmetry, the teeth on both sides will look exactly the same. However, the mandible will look larger on one side or the other, okay? So do the molars on the left side look larger or the same side? You guys answered that. The patient was rotated during imaging, okay? All right. Ooh, this one's nice. What has occurred in the anterior region of the image to appear more radio opaque? What do you think?
Did the patient move forward?
So if the patient was moved forward, everything would look really large, right? Sorry, moved forward, everything would look minified, right?
Mhm.
هنا مو مرة عندنا minification, but something else happened here.
Did the patient tilt the chin?
Tilting the chin, remember, we have that nice little, which is fine, but something specifically is happening in the anterior. What is bothering you about this image? What is bothering you? Ah,
It's
very nice. Somebody just said it. Hunchback. Yes. Why? Rawan, can you tell me why? Even if you want to write it, you don't have to say it out loud if you don't want. Yes.
The anterior teeth aren't minified.
They're not minified. إيش مضايقك هنا?
The cervical spine is very radiopaque.
Yes, it's superimposed. The spine is superimposed. It's completely on here, and at the same time, it doesn't look like the patient moved forward. That means what happened? The patient's hunched down, and the neck was brought forward, bringing the neck closer to bringing the cervical spine closer. So look at this. What structure is superimposed over the anterior part of the jaw? As you correctly said, it is the cervical spine. And the reason is that the radiopaque is due to a ghost shadow of the cervical spine. In this case, it obscured the anterior part. The patient was either or could not position his spine as straight as possible. So remember, there are patients that won't be able to do it all the time. You have older patients, a patient in a wheelchair, and they can't have their spines completely straight, a neck injury, whatever it is. So this is the kind of error that you guys will see. Now, this is not important. This is static. That used to happen with film. You guys won't be seeing that, I promise you. Oh, here's another one. Okay, who can tell me what happened here?
The machine stopped working after imaging half the patient, and the patient's wearing a thyroid collar.
So what do you think happened? Can you put those two things together, Sana? So you said thyroid collar. I don't think it's the thyroid collar, but you're on the right track.
I'm really not sure.
So you said it was
Maybe the patient رفع like his shoulder.
yeah.
Yes.
So,
Oh, the beam hits his shoulder.
okay, so what happened? Because Sanat said there's a something radiopaque here. What is that?
Yes. It's the shield.
The shield, exactly. It's the shield
Yes.
over here. So we brought in the shield, whether it was down here on the shoulder, we brought it up here, right? And now that one is projected upwards, and then it went around the patient's and it stopped, and for safety reasons, it stopped. And what you see is those two things. All right. So the patient hit the patient during rotation and it hit halfway. And that occurs most often with individuals with very large shoulders or a short neck or a stoop stature, or that they have their sit up here. Sometimes we see it with men, especially those that are like really bulky up here, and we come and we put the shield over on this area, and their shoulders are too high up here, so we can't use that. And anyway, we try using other techniques, but this is what happened in this case. Last but not least, what do you think happened here?
The smile line is not like the right anatomy. So the patient is looking upwards, kind of like chin up.
Very good, very good. So you have a reverse smile line here, or it's too flat, so we don't have that gentle smile line you have in a panoramic radiograph. It's the opposite. And the other trick to see is also that your condyles are downwards and pointing backwards, okay? So if you were to see a tip, explain the plane of occlusion exactly as you did. Thank you, Fatima. And then you see that the patient was positioned with her chin tip too far up, and the plane of occlusion is flat with slight reverse curve or frown. Note that the right condyle is also cut off of the image. All right, so that's it for today. I'm going to stop sharing here. Just a few, let me stop the recording as well.